You're listening to Sexual Health and Gynecology on Sirius XM Doctor Radio.
Welcome back, everyone. This is Sexual Health and Gynecology, and I'm Dr. Miriam Greene. Here with me in my next segment, which is Dr. Miriam's News, is Dr. Wendie Berg. And we're looking into one type of mammogram which proves better for women with dense breasts.
Basically, we take a low energy and a high energy picture at the same time with the mammogram machine.
Mm-hmm.
So it's the same machine
almost
that
like
we
a
use
double
for regular
exposure.
mammogram. Correct. And that higher energy exposure is mostly absorbed by the iodine. And so we can subtract out the normal tissue structures.
Right on the one with the one photo.
Exactly. And just see what's enhancing. And so now, because cancers tend to have more blood vessels and they tend to be leaky blood vessels, they will generally enhance very nicely and show up like a light bulb against a dark gray background. And it's just so much easier to see them. We can see very small cancers. And actually, I've been doing work that's supported by the Breast Cancer Research Foundation for many years now, looking at it as a screening test. And the cancers we're finding, the median size was only 6 millimeters, 0.6 centimeters invasive cancer. Extremely small.
Right.
Average for a mammogram is at least double that. And MRI does similarly well, but it's very easy to do a contrast mammogram because we can do this with the same equipment that we use for regular mammogram. And getting new MRI equipment is hard because you have to put it in the basement or the first floor of a building. It's very expensive. And so there is a real limit in terms of how many women can access an MRI for screening right now, even though we know it has a lot of benefits. It's hard to get. At our own center, it's about a 6-month wait for a screening MRI right now. So we really have a need for additional tests like the contrast mammogram.
Absolutely.
It does require injecting, as you were saying, and it does require injecting contrast. So it's an IV, and the contrast is an interesting experience. I've had multiple of these exams. It makes you feel warm all over. It almost makes you feel like you're going to pee yourself, and then it kind of goes away. Not the most comfortable experience, but it's only for a few minutes that it feels that way. So it looks like a very promising test, and this new study that just came out of England, it really looked quite nice at finding additional cancers similar to MRI. The problem is it's not yet FDA approved for screening in the United States. Concern from the FDA was that it was too risky for screening. I mean, so there is a very small, and we're talking less than 1 in 170,000, but it's hard to even know what the absolute risk is. A very small risk of having an anaphylactic response to the iodinated contrast. It's a very serious issue, but it is manageable, done right. And, you know, I think nobody wants to see someone come in for a screening mammogram and then have, die from a contrast reaction. That's the concern the FDA has. But if we can find a lot of cancers early and very easily treated, that's a huge benefit. Most of the cancers we find when we look harder with contrast methods are either higher grade if they're not invasive, or they're invasive. And those are the cancers that we really need to find. And we can find them when they're very small. And so the treatment is very simple if caught early. And, I think every woman deserves the opportunity to have her cancer found as early as possible. If the facility doesn't yet have direct contrast mammography guided biopsy, we can almost always see the same thing with an MRI, but not every patient can tolerate an MRI. And in fact, there have been 4 studies at least looking at that issue, and claustrophobia is not a small issue for a lot of women. And the MRI biopsy, therefore, is not always a good option for every woman. So it is important that the center have contrast mammography guided biopsy capability as well, if needed.
Is there any concern about overdiagnosis or over treatment if there is a more sensitive scan, or how does that factor into the decision making?
That issue is important to consider. As I mentioned, most of the cancers that we find when we do contrast MRI or contrast mammogram are invasive, and the ones that are still ductal carcinoma in situ or DCIS tend to be higher grade. So a higher grade, especially grade 3 or the highest grade DCIS, is biologically important. We know that it can progress to invasive cancer fairly quickly. So it's almost self-correcting, if you will, that we do find more cancers, but they're the more biologically important cancers that we're finding. And obviously, this is a screening test we're talking about, or potentially diagnostic test we're talking about. It is up to and including diagnosis. At that point
Mm-hmm.
is the decision whether to treat or not and how aggressively to
Mm-hmm.
treat. And
Mm-hmm.
certainly there are ongoing studies looking at backing off any aggressive treatment for low-grade DCIS, for example, which may indeed be sometimes over-diagnosis or over-treatment.
Mm-hmm.
We really don't see that very often with the contrast methods, though.